Let's see about palpation of masticatory muscles. Palpation is the examination of the soft tissues using the sense of touch. Palpation of the masticatory muscles will reveal tension or tenderness which can be related to hyperactivity of the muscle as a result of overworking it in an uncoordinated manner. To palpate means to press lightly on the muscle. In a continuous movement, slide your finger along the length and width of the muscle while asking the patient if he or she feels any tension or tenderness as you apply pressure. You are also trying to feel for any abnormality, contraction, or enlargement of the muscle. Now let's see about medial pterygoid muscle. The medial pterygoid muscle is a thick quadrilateral muscle which can be accessed from inside the mouth behind the third molars. Ask the patient to open about 10 to 15 mm from the intercuspal contact. Slide your forefinger posteriorly along the buccal surface. Palpate the muscle by pressing medially as well as posteriorly superiorly. Ask if the patient feels any tension or tenderness. Now, let's see about masseter muscle. The masseter muscle extends from below the cheekbone down to the jaw directly over the molar region. If you ask the patient to clench and hold, you will be able to locate this muscle easily. The muscle can be palpated within the patient, clenching or relaxed. Palpate along the entire muscle length and width while asking the patient if there is any tension or tenderness. The muscle will feel swollen or enlarged in a heavy clench or grinder. Next, coming to the temporalis muscle. The temporalis is a broad fan-shaped muscle situated at the side of the head. By asking the patient to clench or hold and repeat, you will be able to locate the temporalis and follow its shape or form up the side to the top of the head. Palpate along the entire length and width of the muscle while asking the patient if there is any tension or tenderness. The temporalis muscle is the focus of many headaches that respond favorably to occlusal correction. The muscle is also in direct opposition to the lateral pterygoid. It has some origination behind the lateral wall of the orbit of the eye and can be a source of sharp pain behind the eye. Its aponeurosis extends as an innervated sheath to the top of the head and when inflamed can make the scalp sore to touch. Temporal headaches and pain are some of the most common symptoms related to occlusomuscle imbalance. Then coming to lateral pterygoid muscle. The lateral pterygoid muscle originates from the lateral pterygoid plate. It is divided into two sections, the inferior lateral pterygoid and superior lateral pterygoid. The lateral pterygoid is a short, thick muscle which functions to translate the mandible and is active on mouth opening and near final mouth closure. While palpation of the lateral pterygoid muscle, it is not practical. It can be tested effectively to determine if it is a source of pain. Ask the patient to protrude the mandible slightly and at the same time apply pressure on the jaw distally to provoke a muscle response. A sore muscle will respond to this test.